So Dr. Rajaratnam Tangavel asked, I'm used to deliver for 400-500 students in many coaching centers. How many will be coming to the class? She asked. No, madam, we are not that popular. We have a small group, but very, very interested group of students offline. We are mainly very popular online. So online, lot of students will be sitting in their kitchen, cutting bananas, oranges, having a cricket match along with the class and watch you. So don't worry, but we will have some, that's the reason ask your friends to come so that come se come, hamare numbers will not be so small in a live class that Dr. Rajaratnam won't get that adrenaline take off. Basically any teacher love to teach for a big group. So when I say it's a free class, please come, it is not for you but for me, but for the teacher who will be more happy to see more faces to deliver. So, but ophthalmology definitely is worthwhile attending a regular preconditioned teacher's lecture, because every week she is habituated to teach in one or the other part of the country. So that's the reason she knows what are the immediate things to infuse into you intrathecally, so that straight you listen and go to exam like Abhimanyu in the Padma View. So that's the idea. Right. Which will not bind to activated charcoal. Continuing our discussion of JKMD. Basically, carbamazepine, dapsone, salicylates, etc. Charcoal has a role. Capillary leakage leading to hypotension is a feature whenever there is any dengue, hemorrhagic fever. Modified radical mastectomy, what is sacrificed and what is retained. Nipple areola and level 1 and 2 lymph nodes and pectoral fascia are the ones which are basically removed in case of modified radical mastectomy. Carcinoma head of the pancreas is that. What are the most common cause for the development of vomiting? Actually, it is the tumor infiltration of the celiac nerve plexus which will initiate a severe amount of vomiting whenever there is any carcinoma of the pancreas. Now doctor, most micrographic excision of the squamous cell carcinoma is used for what scenarios? What are the indications? Little complicated question. To know most microsurgery is used in basal cell carcinoma itself is a big deal, but still. So recurrent incompletely excised tumors, so ear, digit, genitalia, face, where you can't sacrifice big areas, most microsurgery is what is basically used. On face 0.6 to 1 centimeter lesion, and everywhere else more than 2 centimeter lesion also you will do. Micrographic excision is what you need to basically remember. Right. Clark's level 4, level 3, level 2, level 1. क्या होता है? Level 1 tumor above basement membrane. 2 is papillary dermis. 3 is papillary reticular interface, and 4 is reticular dermis is what you have to basically remember. Mirzi syndrome. What is accept about it? Basically, Mirzi is stone which is impacted in the Hartmann's pouch of the gallbladder that lead to inflammation, necrosis, scarring, ultimately fistula of the gallbladder. And where will that fistula open into? It will open into common hepatic duct. That's the reason cholecystobiliary fistula, not the cholecystoduodenal fistula, is what you have whenever there is any Mirzi syndrome, is what you have to ultimately remember. One more very high yield topic is porcelain gallbladder. Oh, precancerous hai, non-precancerous hai, treat, do you want to do cholecystectomy or not? There are all the issues for the examiner is what need to be remembered. Retroperitoneal sarcomas may, it is a liposarcoma which is most common. Commonest site for angiodysplasia kya hota hai? Generally cecum followed by ascending colon. So ascending colon being the part of the colon, it is the most common site is what you have to basically remember. Cyst trunks operation, cheapest question, thyroglossal cyst. Then extraadrenal pheo, organ of Juncker candle. These are all peppermint questions. This is dirty question. Graves' disease may, what is the dosage of the radiation which is being used? So it is 10 to 15 millicuries or 100 to 150 nanocuries. 10 to I'll recheck between A and B and come back to you. Yeah. In which of the following breast carcinoma? I think 10 to 15 is more correct answer, but let me once more recheck that. Recheck the same. Now, doctor. In which of the breast carcinoma? It is composed of small round cells infiltrating in a Indian file fashion. It is called as classical question in the entrance. I think it is freezing, the video is freezing for the online students. You want to restart? Is it okay there with us? Okay. I don't know, sometimes these evenings our server in US is paradoxically behaving. Just wait for a short while, it will start running through. Sometimes it happens. Yeah. Now, doctor, this is basically invasive lobular carcinoma. What you are able to see? Single rows of cells which are infiltrating. That's called Indian file pattern is what you see in invasive lobular carcinoma. This question was asked many times in APPG and JIPMER, AIPG, lot of exams. Burkhardt triad, acute epigastric pain, violent retching, inability to pass nasogastric tube. All the three combination, where do you find?